Welcome to the August 2nd, 2011 Frontline Reports podcast from Doctors Without Borders, Médecins Sans Frontières, or MSF. I'm Melissa Pratt. South Sudan became the world's newest country when it gained independence on July 9th, but this new nation faces enormous challenges. South Sudan remains mired in a medical humanitarian emergency. 3 out of 4 South Sudanese have no access to even the most basic health care. Maternal mortality rates are among the highest in the world. And preventable diseases like malaria, acute diarrhea, and measles are common causes of death. At MSF projects, the numbers of malnourished children who need treatment have been climbing for the last few years. That's due to bad harvests, rising food prices, and increased insecurity. In 2010, teams saw a 50% increase in malnourished children compared to 2008. It can be extremely difficult for people to access the few health services that do exist. There have been heightened hostilities between North and South Sudan, and violent attacks in contested border areas. In addition, there are intercommunal clashes and cattle raids, and attacks by new southern militias. These have all claimed lives and pushed people from their homes across South Sudan this year. MSF runs 13 medical projects across the newly recognized nation, including in Aweil Hospital, the only referral facility in northern Bahr el Ghazal state. The MSF team works with local medical staff in the maternity unit and the pediatric ward. MSF's Heather Whelan was in South Sudan, and she brings us this report.
And we are going to be a nation. We are going to be our own, not for another people.
Thousands cheered on the streets of South Sudan's capital, Juba, on July 9th, celebrating the birth of a new nation. This baby boy in Aweil Civil Hospital is among the first children born in the world's newest country. He is starting his life in difficult times. Despite the optimism of many people in South Sudan, tensions with the North remain. Hundreds of thousands have been displaced by violence or have returned from the North, and there's not enough food, water, and shelter for everyone. On top of that, the annual hunger gap has begun, the time between harvests when food is particularly scarce. In Aweil Hospital, MSF runs a unit for malnourished children and babies. More than 2,800 children were treated here last year for severe malnourishment. Joseph Nagong Akur is the supervisor of the Therapeutic Feeding Center, or TFC.
Yeah, this is TFC, where we are admitting the malnutrition cases and also plus measles cases. In TFC, this is the peak season. We have a lot of patients. They are being admitted because of malnutrition.
Malnourished children who are admitted as inpatients are at an immediate risk of dying. They've developed dangerous complications like diarrhea or pneumonia. In the intensive care unit in July, 8 tiny and very sick babies lay on beds. One was covered with gauze, and his skin appeared to have burns. These are lesions, Akur said, which can happen as a result of severe acute malnutrition. He pointed to another child, lying on his mother's lap, with a tube inserted into his nose.
This child is a child with a malnutrition and is admitted because of diarrhea, then plus vomiting. And is not taking milk by mouth. That's why we have put NG tube. So the child is feeding with the NG tube now.
Without the presence of MSF, many of these babies would not have a chance. South Sudan is still recovering from a decades-long civil war. The country's health infrastructure has crumbled or is non-existent. The lack of access to health care affects women and children the most. 1 in 7 women dies here due to pregnancy or childbirth. To reach a health facility, many pregnant women, often already in labor, have to walk for hours or even days due to the lack of roads or affordable transportation. Last year, MSF delivered more than 5,600 babies in South Sudan, half of these in Aweil Hospital. More than 150 of those births were by cesarean section. Without MSF's help, many of these women would have died. In 2 years, MSF has been able to reduce the maternal mortality rate in Aweil Hospital by almost 90%. Meanwhile, the number of births have gone up by 30%. Women's health is vulnerable in South Sudan. In addition to the risks of childbirth, women suffer from a high rate of anemia and commonly experience miscarriages. Heather Harris is an MSF midwife supervisor at Aweil Hospital.
It's probably to do with poor nutrition, ill health. Often these women are having very large families, and it's not, it's very common for a woman under 30 to have 7 or 8 children, many of whom may not have survived. And of course, frequent pregnancies, you're going to statistically get more miscarriages. The women here work very hard, and life's a bit of a struggle. So trying to find food to feed all those kids, and your husband and yourself. Women, I think, will always have the burnt chop syndrome. They'll take the last thing that's on the plate. So it's very complex, I think, but wherever there's poverty, you're going to get usually a lot of miscarriages.
A woman in a bright red dress sits patiently on a bed, receiving a blood transfusion. Many prospective mothers arrive at the clinic in a poor state of health, said Harris.
Anemia is one of the big issues here. Many of our women are anemic, and so trying to get blood for them has become an art form.
With no central blood bank in South Sudan and cultural sensitivities that keep people from donating blood, MSF constantly faces a problem getting an adequate blood supply. MSF staff are meeting with community elders and village chiefs, as well as the health authorities, to obtain permission and support for efforts to encourage blood donation. MSF has worked in South Sudan for 30 years, providing primary and secondary care, as well as treatment for tuberculosis, HIV/AIDS, Kala-Azar, and sleeping sickness. After South Sudan's independence, MSF's presence in the country remains vital. It will likely take many years before the new nation can establish a functioning health system that can properly cater to the needs of its people.
Find out more about MSF's work in South Sudan and other countries. Go to msf.org to find the MSF website in your home country. If you have questions or comments, send an email to msfpodcast@msf.org. MSF, or Doctors Without Borders, is an independent medical humanitarian aid organization that delivers emergency assistance to people affected by wars, epidemics, and natural or man-made disasters in more than 60 countries around the world.